The pathological condition that I did my research on is depression for Class and Function of Human Body, fall of 2016. What is depression? Often defined as a mood disorder or a chemical imbalance in the brain, individuals diagnosed with this condition is often feeling sad or having loss of interest in daily activities. Causes of depression can be genetics, biochemical, hormonal, seasonal, or life events. An example of hormonal can be the birth control pills, as a side effect of that is depression. Which cells are affected by depression? Nerve cells in the brain are greatly affected, and the function of these nerve cells are to build memories in the brain. And in a depressed person, these nerve cells are decreased, the connections decrease. And as you can see here in the picture, it says right here, smaller hippocampus. Within the hippocampus is where the nerve cell connection originates from, and so it decreases and becomes a lot smaller. Here's a better picture where you can see where the hippocampus is located within the brain. And then you also have the amygdala right here, located here. In this section, it becomes more hyperactive. And so what the amygdala is part of the brain affected when a person is diagnosed with depression. So this part of the brain, it does become more hyperactive, and it's associated with pleasure, sorrow, and fear. The next one is the thalamus. This section of the brain receives sensory information and passes to the cerebral cortex, linking it to feelings. And as mentioned about the hippocampus, it's the section of the brain associated with memories, which produces new neurons and builds connection. Researchers found that this section is a lot smaller in depressed people. Other organ systems that are affected by depression is the nervous system, impairing the nervous system and causing pain and discomfort. Within the immune system, the T cells are weakened, which causes the likelihood of harmful bacteria encounters. For the cardiovascular system, the heart diseases or even heart attack becomes more prominent. And then what kinds of signs are out there to look for in depression? So we have sadness, hopelessness, lack of interest, anxiety, anger, and most commonly known, suicidal. And so treatments that are used to counter depression. The available treatments out there are medication, therapy, and other forms of treatment options. So the first type is medication. We have selective serotonin reuptake inhibitors, SSRI. What that is prescribed first as it has less side effect and commonly used. And then we also have the serotonin norepinephrine reuptake inhibitors. That's another source of medication that can be taken. And then we also have antidepressant such as atypical and tricyclic. These are prescribed only if the SSRI is not working, as it has many side effects. Another form of treatment is therapy. The cognitive therapy behavior, the CBT, it focuses on the individual and how they think. Then there is the interpersonal therapy, the IPT. It focuses on personal relationships between the individual and other people. And then there's mindfulness-based cognitive therapy, the MBCT. It focuses on the moment and the time right now. And then other treatment options are the electroconvulsive therapy, these ECT. So the electrocurrents are passed through the brain while the individual is under anesthesia. This treatment method is performed on more severe depression. And then the other one is the transcranial magnetic stimulation, the TMS. So the individual is awake while this procedure is performed. A magnetic pulse is sent to stimulate the nerve cells associated with mood. This treatment is performed when individuals are not responding to antidepressants. And so prevention's out there to help counter depression. So methods such as boosting self-esteem, reaching out for help, obtaining treatments, education, psychotherapeutic, nutrition interventions are some forms of methods for prevention. And then consequences of depression, if it's not dealt with, there's the short term of depression is having no interest in daily life, oversleeping, or the opposite of that is having insomnia. There's no motivation at all. There's low level energy and always constantly feeling alone. And then in the long term, without it being dealt with, it can compromise your immune system and cardiovascular system and weakening these, causing chronic physical pain, increase of heart diseases, isolating oneself from everybody, and then the chance of death increases with the long-term consequences. And so, in conclusion, as a pathological condition, depression can greatly affect the brain, causing many health conditions. There is no cure out there to eliminate depression, but there are methods and treatments to help prevent depression from becoming too severe. And so this does end my presentation about depression. Thank you.